I'm the professor of pediatrics, so I'm specially looking after the neonates. Overall in Nepal as well, and in this area, most commonest disease are the infectious disease, and most of these infectious disease can be prevented.
Usually we see lots of kids coming for a variety of health conditions, primarily of infective origin. The most common are the respiratory problems, gastrointestinal infections and other infections where we see kind of under-resourced.
This infectious disease definitely it's affecting them, and their school absenteeism is there because of that diarrhea or respiratory tract infections, and especially on younger children they will have got this repeated viral infections, so that they become prone for the asthma in the future also.
Most of the enteric diseases do happen in this part of the world. So that's why we chose Nepal as one of the countries to do the research for typhoid and cholera in Nepal, so that we can generate local data which will help health authorities to take the informed decision. At the time in 2017, the question was, can we do clinical trial of typhoid vaccine in Nepal? Because there were very few sites who were doing such kind of activities. We visited at least 17 to 18 medical schools in Nepal. I was amazed to see the immense potential Nepal had. But unfortunately, that was untapped potential.
Vaccine coverage is good for all the vaccines, those are listed, but those which are not listed, then are not given free by government, then access to the vaccine is a challenge. People can't afford RSV vaccines, which is not in the part of the vaccination system, like HPV vaccine, which is very expensive.
When you take IBI's mission of discovery, development, and delivery of safe, effective, and affordable vaccines, it means that we work in countries that have the diseases and lack the ability to make these diseases go away.
So we started with typhoid and cholera, 2 COVID-19 studies which are still going on. Now we have started one RSV study.
Research in pediatric population is not a very easy, it differs from adult population. So many of the times parents have a very conflicting kind of perception. Many of the times the influence of grandparents is there. So we usually do listen to all the family, like grandparents and others, if possible.
Many people from within the community are employed for doing the clinical research. So it's an opportunity for employment for many people.
So let me introduce our team here.
At each site, we do have a team headed by one principal investigator, helped by many co-investigators, site coordinator, lab technicians, nurses, field workers who go to the community. Because when you run clinical research, participant has to come from the local community.
What is unique about this site is the approach that we take for the clinical trial. We actively engage the community. One geographic terrain also. This is outside the Kathmandu Valley, and this is hilly also, bringing patient as well as if you have to do the follow-up. Then, and you know that in Nepal, not every road are paved.
It's a natural condition. I believe it's a 10% land and 90% hills. So it's little difficult to reach out to some of the sites. Weather changes drastically here.
We have 18 rural health centers which is scattered in this area, and we don't calculate the distance by the kilometers, but we calculate by the time, that how much hour, how many days it will take to reach there.
We have many field workers that in all the vaccine trial site in Nepal, they go door to door to the community.
My name is Suman Shrestha. I am working at the Dhulika Hospital at the clinical trial site in a trial vaccine. And today I am going to collect the CLA samples of the participants. It's a quite rainy day today, so hope my day goes well. Hello sir, good morning.
Hello, Sumana. Good morning. It's very difficult for them who is working on the field. They have to go by foot, they have to go by hiking, sometimes they have to cross bamboo bridges in order to collect samples.
A clinical trial, especially for our country, it has multifactorial benefit. We have developed facility, and I think it is a world-class facility to conduct any trial. I learned so much, and now I have confidence that I can run other even bigger clinical trials.
So I think we need to do more clinical trials. The baby who get vaccination, they will have insurance system to 2 years. So mother are very happy because they are very poor patient. So when we get the results, we can give the vaccine and improve the health status of all the babies in Nepal.
We do weekly follow-up to know about the health status of our participants. So because of this clinical trial, participants develop health-seeking behavior.
IBI as such is a non-profit organization. We have limited resources. Of course, we are getting great support from government of Nepal. But to expand it further, of course, we will need support from philanthropic organization, as I mentioned, for the betterment of the public health in Nepal for the Nepalese people.
It's one world, and that a problem in one part of the world can rapidly become a huge problem in other parts. And we hope that vaccines are a solution, and that countries that participate in organizations like IVI are really contributing to limiting the impact of diseases not only in distant places, potentially at home.